Hello, I am Dr. Sundeep Upadhaya, Professor and Senior Consultant Rheumatology Immunology at Indraprastha Polo Hospitals, New Delhi. Today we'll be discussing on the topic of arthritis, its causes and its various treatments. Arthritis is inflammation of the joint, and in short, it is the equivalent of what we see as swelling of the appendix, which is appendicitis, or the gut, which is enteritis. What differentiates it from regular swelling is that quite often arthritis is based on autoimmune damage. It's based, or it springs from the body's own immune system attacking the joint, causing inflammation. The parts of a joint are as follows. There are two main articulating structures, or the bones of the joints. They attach or come together close to the articular cartilage. There is something like a shock absorber between the two articulating structures of the joint. In and around the joint are the capsule and its supporting structures, tendons, ligaments. And inside of the joint is the substance of the joint, or the synovium, which is the one reason why you have inflammation in the joint. I will reiterate that there are 4 or 5 different types of arthritis. The one that rheumatologists, immunologists are most concerned with, and the one that is most amenable to treatment, is the inflammatory arthritis or autoimmune form of arthritis. These are given various names as rheumatoid arthritis, spondyloarthritis, psoriatic arthritis, inflammatory bowel disease related arthritis, gout, and so on and so forth. Arthritis is extremely common. Almost 1 in 5 people on the planet will be afflicted with a musculoskeletal problem, or in common parlance, arthritis, for a sizable number of their working life. The various causes of arthritis are as follows. 1 is autoimmune or inflammatory. 2 is degenerative of age-related. 3 are miscellaneous, or factors related to trauma, to infection, or to degeneration that is beyond just age-related. And some very rare forms like genetic disorders, developmental disorders, rarely some malignancy or metabolic bone disease. So the risk factors for arthritis are as follows. 1 is age, and a lifestyle that includes either contact sports or heavy running, overweight, chronic diseases like diabetes and hypertension. So that amalgamation of symptoms, or of the milieu of such 5 things lead to osteoarthritis very commonly. Broadly, the core symptoms of arthritis are swelling of the joint, pain and stiffness of the joint. Most patients with inflammatory arthritis or rheumatoid arthritis, and indeed even spinal arthritis, will complain of pain that's associated with stiffness. And the patient might have pain that is excessively difficult at night, has morning stiffness, the patient wakes up and is not able to move his or her hands for an hour's time, has difficulty turning sides in the bed, has difficulty waking up and walking to the toilet when he needs to go. So pain as well as stiffness, that's the core point. and that's the one important symptom of inflammatory arthritis. So arthritis is diagnosed based on a set of information that you glean from the patient. One is the history. You ask the patient a set of questions and you get some answers which then guides you through the examination findings. That's the one important doctor to patient interaction that makes the diagnosis of arthritis. Yes, certainly imaging or radiological imaging can diagnose arthritis, but quite often the plain radiology to show erosions or joint space narrowing, which is damage to the joint, will be very late in picking up arthritis. MRI is a modality of radiology that picks up arthritis early on, and there are times when you need to specifically look at joints that have inflammation in the spine, for example, the sacroiliac joint, and sometimes other joints that can't be imaged properly with a plain radiograph. Treatment of arthritis can be broadly classified into its major core treatment, number one. Number two, the treatment around the core treatment. And finally, advanced treatment. So there is a network or a hierarchy of treatment. So the most common treatment for arthritis includes anti-inflammatory medications, sometimes steroids. Then beyond that, there is treatment for arthritis in the form of disease-modifying drugs, or what are simple medications made in the past 50, 60, 70 years for controlling joint inflammation. The simple answer to that is both yes and no. The yes is for those arthritis that affect only maybe a joint or two, and the only way you can get rid of a disease is by completely changing it to a different form. For example, if the knee joint is completely destroyed, you can cure it by changing it by a titanium implant, and that's total knee replacement. Similarly, a hip replacement will cure the hip of an OA, of the osteoarthritis of the hip. But apart from that, there is no cure for arthritis, especially the ones that have an immunological basis or have multiple joints involved. So technically, arthritis can't be cured for non-traumatic illnesses of the joint. Arthritis can be prevented by taking care of the joint and keeping good habits. It can be prevented with the right kind of diet, exercise, and certainly by avoiding smoking. It's something that has been shown to link with rheumatoid arthritis and spondyloarthritis, and there is also a role of smoking in inducing various forms of antibodies. Patients who have psoriatic arthritis, who have various forms of ankylosing spondylitis, also don't do well when they continue to smoke. So other than the fact that you have a set of modifiable and a set of non-modifiable factors, one may choose to at least keep a healthy lifestyle. To summarize, what we've discussed in the past few minutes is as follows. What are the types of arthritis? It's mostly inflammatory or autoimmune and degenerative. Rarer causes can include damage or trauma and infection. Second, we made a case for the types of arthritis, what causes them. Causes of arthritis are related to genetic factors, environmental factors, to smoking, and to bad habits and trauma, repetitive strain and repetitive injury. Stay safe, stay healthy, stay informed. Namaste.